Well, get this, it is the most common eye disease among diabetics and leading cause of blindness in American adults. Back with us today to talk about diabetic eye disease is Dr. Al Jabali of Newsom Eye. Good morning. Welcome back.
Thank you.
I want to mention too, I love when you're here. I love when your team is here because Newsom Eye, maybe you've seen them around town or seen the name, but I love that you have this philosophy where you're like, everybody deserves Newsom Eyes. This is your specialty. This is what your team loves to do, to educate, to make sure that they have the best vision, the best eye health that they can get.
Correct.
So let's talk about part of that is so interesting to me as far as this diabetic component that I had no idea was an issue with the eyes. Where are you guys seeing this? How common is this?
So people who are diabetic, they get diabetic eye disease, or what's also known as diabetic retinopathy. It's really damage to the small vessels in the back of the eye in the retina. So it's pretty common, and it's one of the leading causes of blindness under the age of 65.
I had no idea. So how is it that, what does that mean? So if you have this, what is going on with the eye? How do you know that you have it?
So when you have diabetes, you really should have the retina evaluated to see how advanced the disease is in the eye. Because like the rest of the body, you have small vessels in the retina, and those vessels could have some damage and eventually leak. At the beginning, you might not know how bad it is. You might have a little bleeding in the periphery, and then later on in the stages, it could advance and you might notice it more.
So if someone is diagnosed with diabetes, you right away maybe get the eyes checked, and is this something you need to constantly kind of check and monitor?
Correct, correct. So if somebody has diabetes, they really should have an annual exam.
Okay.
And then depending on how bad it is, they might need more than an annual exam, and depending on the severity of it and what treatment is required.
And by the way, I had to ask too, because when we were talking earlier, both diabetes type 1 and 2, this is the same kind of issue that people need to look out for.
Correct. Even people, sometimes they get what's called diabetes in pregnancy. So you have type 1 diabetes, you got type 2 diabetes, and also diabetes in pregnancy.
Can you have the same eye issues during pregnancy as well? No way. Wow. So how do you treat this? What are our options here?
So we do have options. It really depends on the severity of the disease. It ranges really from having, number one, controlling your diet, controlling your sugar. As long as your sugar is well controlled, your blood pressure is controlled, eating healthy and active lifestyle, then we have also available medicine that we could use, or lasers are available as well.
Okay. What else should people know about this? Because again, you say this is the leading cause of blindness for
under the age of 65.
I mean, that's just incredidible.
So unfortunately, sometimes people put the exam off until it's too late. And that's when really, it's kind of not really too late, but it caused more damage than what you want it to cause. So the earlier you know you have diabetes, the earlier you get a screening and see how bad it is. I think that's wise. And
as far as the actual visual, I mean, what is it? What are they not able to see? I mean, what are those kind of early symptoms in regards to vision?
So early symptoms, or when it really gets to the center of the vision, things start blurring out in the center.
Okay.
Things become fuzzy, blurry.
Near and far distance as well? Okay.
Correct.
Well, as we kind of wrap up here, and again, I love this philosophy that you guys, really entrust and want people to know that everybody deserves Newsom Eye. This is your specialty. This is what you guys care about. How would they best find you if they want to find out more info? What would you have them do, Doctor?
So we have a good team at Newsom Eye. We have 3 locations, and they could call our office and we could set up an appointment and have a screen done for them at least.
That's perfect. All right, Doctor, thank you so much. We always appreciate when you and your team are here.
Thank you. Thank you for having me.
All right, we'll make sure and put the info on our website as well.